Hello and welcome to today's episode of the Central Ray podcast, where in this Registry review series we break down key topics to help you ace your ARRT exam, stay sharp for CQR, and most importantly, deliver safe professional care every day. I'm Ryan Ross, your host and fellow radiographer, and today we're tackling a topic that underpins everything we do in patient care, and that is infection control. Even though it might feel like common sense, infection control remains as one of the most tested and most important areas for registry candidates. And for practicing techs, it's an everyday responsibility. So in this episode, I'll walk you through the main concepts as outlined in the ARRT 2022 content specifications, explain the key terminology, and share some memorable examples to make sure you're ready for any question or clinical scenario that comes your way. Sound good? Alright, let's scrub in. Section 1, Chain of Infection. So let's start with the chain of infection. Sometimes this is called the cycle of infection, because understanding this concept helps you to see exactly where you can break the chain and protect your patient and yourself. The chain has 6 links. In order, these are pathogen, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. So let's take a little closer look at each one of those. So pathogen, this is the infectious agent. It can either be bacteria, virus, fungus, or parasite. So think of MRSA or influenza or tuberculosis. Reservoir, this is where the pathogen lives and multiplies. That could be a human, an animal, or even equipment or surfaces. Portal of exit. This is how the pathogen leaves the reservoir, like sneezing, coughing, and blood or other bodily fluids. The mode of transmission. This is the big one, and we'll come back to it in greater detail, but this is how the pathogen gets from one place to another. Portal of entry. The way that the pathogen enters a new host, and this can be through broken skin, mucous membranes, inhalation, etc. And susceptible host is someone who can't fight off the pathogen. Patients are weakened or with weakened immune systems, neonates and the elderly are examples. So ask yourself, as a radiographer, where do you have the most power to break the chain? It's at the mode of transmission and the portal of entry. Clean hands, PPE, and aseptic techniques make a huge difference. Now let's unpack these modes of transmission in a little more detail. Modes of transmission. We categorize these into direct and indirect transmission. Direct contact. This is where you touch a contaminated patient or bodily fluid directly. For example, helping a patient onto the table without gloves and they have an open wound. Droplet. This is large respiratory droplets, like from a cough or a sneeze. These can travel a few feet and land on your mucous membranes. Think of the flu or COVID-19. Then we have indirect transmission, and this can occur in 3 different ways. We have airborne, which is smaller particles that remain suspended and can travel further, like tuberculosis. We have vehicle-borne, fomite. This is an inanimate object like a contaminated receptor, stretcher rails, or even your lead apron. And then vector-borne, through an insect or animal. It's less common in radiography, but important to know. Mosquitoes carrying malaria or ticks carrying Lyme disease would be examples of this. So thinking about your daily practice, how can you minimize indirect transmission? Next up is asepsis, and this means being free from disease-causing organisms. We have 2 main approaches here. We have medical asepsis, also called clean technique. This reduces the number and the spread of pathogens. Examples include washing your hands, wiping down equipment between patients, and wearing gloves. Then we have surgical asepsis or sterile technique. This is a step higher and creates a sterile field for eliminating all microorganisms used during invasive procedures or when inserting a catheter, for example. Don't forget the difference between disinfection and sterilization of equipment. Disinfection removes pathogens from surfaces but doesn't kill all the spores. Wipes and sprays are disinfectants. Sterilization destroys all the microorganisms and spores, and this is done with heat, gas, or chemicals, as they do for surgical instruments. So when you're wiping down a cassette, that's disinfection. Preparing a surgical tray, that requires sterilization. Now let's talk about standard precautions. These are minimum infection control practices we use with every patient every time, because you can't always tell who's infected. Hand hygiene is number one. Washing or sanitizing before and after patient contact, after removing gloves, or after contact with potentially infectious materials. Personal protective equipment or PPE. These would be gloves, gowns, masks, eye protection, and these are based on the anticipated exposure. Then safe handling of equipment and surfaces. Clean and disinfect any shared equipment such as the bucket tray, lead shields and control panels. Then proper disposal of contaminated materials. Place linens in designated bags, dispose of sharps in puncture-proof containers, and follow your facility's protocol for blood, bodily fluids, and used supplies. And then finally, we have safe injection practices. Never reuse needles or syringes, and always use aseptic technique. Remember, these are standard, every patient, every time. Transmission-based precautions. Sometimes standard precautions aren't enough. That's when we add transmission-based precautions depending on how the disease spreads. Contact precautions for infections spread by touch like MRSA or C. diff. You should wear gloves and gowns. Droplet precautions for infections spread by larger droplets such as flu, so something like wearing a surgical mask and keeping a safe distance. Then airborne precautions for pathogens carried in the air such as tuberculosis or measles, using something like an N95 respirator and a negative pressure room if available. If you're called to do a portable chest on a TB patient, which type of mask should you wear and why? That's right, an N95, because tuberculosis is an airborne pathogen. And finally, a few other important concepts you might see on the exam or in practice. We have neutropenic precautions, or reverse isolation, protecting the patient from you. This is used for patients with severely compromised immune systems like bone marrow transplant patients or more commonly burn patients. Then we have healthcare associated infections, or otherwise known as nosocomial infections. These are infections a patient acquires in the hospital, such as catheter-based urinary tract infections or ventilator-associated pneumonia. Your role in preventing these nosocomials is huge. Proper hand hygiene, aseptic technique, and cleaning of equipment go a long way in this prevention. So let's recap. Today we covered the chain of infection, modes of transmission, asepsis, standard and transmission-based precautions, and some additional concepts like neutropenic precautions and HAIs. I hope this episode helps you feel more confident, not just for your registry exam or CQR, but also for your day-to-day work as a healthcare professional. Infection control is a team sport and you are an essential player. Before we close, here are a few thought questions to reflect upon. Which link in the chain of infection do you think radiographers are most effective at breaking and why? How does your own practice align with standard and transmission-based precautions? Can you explain the difference between medical and surgical asepsis to a co-worker? Thanks for joining me today. If you found this episode helpful, be sure to subscribe and share it with a colleague who's also prepping for their exam. And as always, keep your skills sharp, your hands clean, and your patients safe. Until next time, this is Ryan Ross signing off from the Central Ray podcast. Stay safe and keep shining in your practice.